What do you see on the fundus of this 46-year-old male who presented for new glasses? It's hiding behind the lashes, right?
Looks a little bit elevated.
We took another picture. Click on the other picture. Now we have a very clear picture of it. What can you tell me about this lesion?
You can tell that it's elevated.
How do you know it's elevated?
Because the vessels are darker.
Okay, so on optos, that means it's elevated. What else?
It's inferior temporal.
All right.
You can tell that there's no breaks.
Okay, so no visible tears or breaks. Okay. What about the shape of it? Because here the big question is it a detachment? Yes or no? Right. So it kind of the shape, which it looks like kind of like a blister, if you want, right? It's like round, very round, maybe a little too round. Is there a name for it?
Bolus.
That's right. It's bolus. Okay, so inferior temporal, bolus, no breaks. Do you know what condition we're looking at?
Retinoschisis.
Okay, that's retinoschisis. So what separates retinoschisis from retinal detachment? That's the big one. You'll be surprised to know that some doctors would send that to the ER saying, hey, this patient has a retinal detachment. So here are all the things that will confirm that it's schisis versus detachment. Schisis, usually inferior temporal, often in both eyes. This guy just have it in one eye. The other eye might develop it over time. Bolus. Bolus is probably one of the most specific characteristic of a retinoschisis. A detachment, usually when there is a break, the retina folds. And we call that corrugation, right? It kind of like folds on itself. That's classic of RD. Now, probably the most important is there are no breaks. There are no breaks. I looked carefully on the exam and you look for a little tear, a little hole, but there is nothing, right? Why? Because schisis does not have tears or breaks. And also the fact that this patient has no symptoms. So some RD patients don't have symptoms, but schisis almost never has symptoms. Also, there is a thing about the scotoma. You know that both patients with schisis and RD have some type of loss of peripheral vision in that area. But the difference is RD have a relative scotoma, and retinoschisis has an absolute scotoma. What I do on my exam, I take a very tiny circle of light and I shine it just on the normal retina and I say, do you see it? The patient is like, yes. And then I put it on the area of schisis. Can you see the light? And you say, no, I see absolutely nothing. That's absolute scotoma. If that would be a retinal detachment, the patient would see some type of light, even faint, but he would see it. I did that on this patient, he wouldn't see anything. And the last one we do is scleral depression. If it's a retinal detachment and the retina is detached and it's floating around, when you indent the eye, you can oppose the back of the eye to the retina and put them together again. A schisis is not this. A schisis, the retina never separated. It's a split within the retina. So you're gonna press with the scleral depressor and everything is going to move together. That's another thing we use to justify the fact that this is schisis and not a detachment.